This is the IHE Patient Care Coordination 2016 domain update. We give this once a year just to be able to update everyone with what we've been working on for the past year, take a little bit of a look into what we're working on going forward, and just some general overview of how to get them involved and engaged in PCC. My co-presenter is Laura Langford, so she'll take the first half of the webinar and I'll take the second half. If we can go and advance to the next slide. You'll see our pretty mugshots there. So obviously I'm on the left. I'm a co-chair of the PCC Planning Committee. I have been for the past 4 years and have been involved in PCC since 2007 on many different levels. So my other job is as Director of Strategic Consulting for Ready Computing. We are a health IT consulting firm. We do a lot of interoperability implementations, a lot of IHE-based implementation work, and that sort of thing. So with that, I'll turn it over to Laura so you can introduce yourself and get us started on the first half of the presentation.
Thank you, Tom. Welcome, everyone, and we appreciate you joining us today as we do an overview of the Patient Care Coordination Committee. Yes, I also am a co-chair on the Planning Committee for the IHE PCC, as we refer to it, and I am a nurse informaticist that works for Intermountain Healthcare. Let's look at the next slide, please. Just a quick look at our learning objectives. So today we're going to talk a little bit about how we got to where we are today and where we're going. So let's go ahead and go to the agenda and the next slide. So I'll do a few slides around the history of IHE, but especially PCC, talk again about PCC's vision and mission, our goals, kind of what it is we do, and how you can get involved. Let's look at the next slide. This slide is a diagram that shows all of the different, my WebEx isn't catching up. Let me make sure that the WebEx catches up. We just need to go to the next slide that talks about the IHE domains. There we go, I'm seeing it now. So this slide just shows all the different domains that IHE has in action today. It started in 1998 with radiology. And very quickly, within a few years, they found that we needed to do a little bit more coordination amongst many different areas. And so we started the IT infrastructure in 2003. And then as you can see in 2004, 5, and 6, several different domains came online. Patient care coordination came up in 2004. And so we've been active in working on interoperability needs related to patient care coordination specifically for over 10 years. And we can talk a little bit about the work we've done there. But if you have an interest in any of these other areas, there are other presentations being given this summer, and if they've already been given, they're recorded. And so you can reach out to Nancy, and she can help you find information about all of these other domains if you are. But today, we're going to look at patient care coordination. Look at the next slide, please. As I mentioned, the Patient Care Coordination was formed in 2004. The initial sponsors were the American College of Physicians and HIMSS, and they really looked at medical summaries initially. It was the first PCC profile that was developed and delivered, and it went out for trial implementation in 2005. Since then, we've worked on 23 different content profiles, 9 integration profiles, and 7 workflow profiles. Let's look at the next slide. On this slide, we're going to talk about our vision and mission. So with PCC, we're looking at how we can connect across all the different disciplines and care paths for the patient. And it's this continual connection and across. And so as you know, you can kind of do very much of a deep dive within a silo, but that's not how patient lives are. So we're looking at how we can get connected across so that the patient experience can be more connected and smooth. And so our mission is to develop and maintain the profiles that support care coordination across providers, patient conditions, health concerns, and time. And there's a link at the bottom of this slide, which these slides will be available, and also the recording, so you can get the link, so don't worry about scrambling. Next slide, please. Our goals are currently wrapped around content, workflow, and nursing. And the content is all looking at what is the content that needs to be exchanged for different care experiences or well, not the workflows, we'll talk about that in a minute, but diagnoses, care problems, patient concerns, things like that. And so we look at very specific content areas in that way and say, what is the data and the details that need to be exchanged? We also look at the workflow because it's not just about the content, but we want to be truly interoperable in a helpful way. We need to look at how is this being consumed by our clinicians and the patients. And so we look at the workflow, and we'll develop white papers or other profiles that look at how to exchange it in a workflow way, what should come first and next, and things like that. We also, within PCC, have a strong interest in nursing and look at the workflow and the needs around the nurses and their interoperability needs. And that's really because we see that nurses carry such a load of work around the patient care coordination. It's not unique to nursing, obviously, and our work is not unique to nursing, but we do often have kind of a special focus on what's happening in the nursing domain. Let's go to the next slide, please. So now what I wanted to talk about a little bit is our scope. Our scope is really very general as far as what the clinical care is. We do sometimes get into something very specific, whether it's a barcoded medication administration or something that is very nursing specific, or maybe something related to emergency care, but it's also very general. And we look at order processing, coordination with other domains. So if we need to work with the cardiology team or radiology, we'll often cross over and work with them. We very much like to keep a patient perspective of the care being provided. So what is this interoperable experience from a patient's point of view? And of course, the clinician perspective. So we look at it from all directions. And with the workflows, we look at what is needed not only within, say, a care domain of obstetrics, but what is needed across multiple specialty domains. So if it's a cardiology type of thing, what needs to happen from a home care, emergency care, inpatient, intensive care, subacute care, all sorts of things. So we'll look at what's happening across the workflow that may involve many specialties, but perhaps look at a specific care coordination domain. So, and then we also look at some of the messages and the reconciliation that needs to happen with our workflows. Next slide, please. And where are we? We're kind of worldwide. We obviously have a huge impact within the U.S. We do a lot of development and implementation within the U.S., but also Canada has been involved with our development. Europe, we have a strong presence in Europe. I think we have some Europeans joining us today, and we welcome you. That France, Italy, very strong in the implementation and development of IHE profiles, especially within PCC. And we've also seen some implementation of our profiles happening in Asia and in Saudi Arabia. Been very involved there. So if you'd like to know any more about those efforts and projects, there are some links that are provided for you on this slide. So I encourage you to look there. And now to kind of do a deep dive into what's happening in our profile and technical frameworks, I'm going to turn it back over to Tone. So let's go to the next slide, and Tone, I hand it off to you.
Great, thank you, Laura. So as we've been around since 2004, as you saw earlier, and through those many years of profile work, we found ourselves kind of focusing on three different profiling approaches or profile types. Content, we have several content profiles that really just focus in on what's the structure of the clinical or financial content that needs to be exchanged. It's really solely focused on that. It doesn't look as much to the interaction of that content. It's more focused about how do we structure the content, what vocabularies or terminologies are available, that sort of thing. It uses a content creator, content consumer actors, and uses one transaction, which is PCC share content. So it's pretty simple on the integration or interaction standpoint. And then the standards that we use as part of that include CDA as well as FHIR. We've been doing quite a bit of work with HL7 FHIR over the past couple of years as that's becoming more prevalent in the industry as well. So integration is another type of profiles that we work with. Integration is more focused on what's the interaction between two systems, right? It may include some content pieces, and it typically does, because without content you really don't have much in the way of clinical interoperability. But it's what do you do with that content, and how do the systems act or behave when that content is received or when certain content is received or sent. So that's what integration profiles focus on. They use a variety of different actors and transactions. Sometimes we reuse actors and transactions across integration profiles. Sometimes we create new ones if we need new ones. And some of the underlying base standards include HL7v3 messaging, HL7 Fire, HL7v2, and others. And finally, we get to workflow, and workflow is a really, really interesting topic. Workflow is kind of the combination of the above two, right? It looks at the larger set of clinical care paths and workflows that occur, and it puts all the pieces together, right, to define the interaction between a patient and multiple of their providers. Workflows are typically cross-domain, meaning that they align the pieces between domains like cardiology and radiology, maybe patient care devices, and others. So workflow is a topic of continual and continuing interest, and I believe it's what we'll be spending more and more time on going into the future. Next slide, please. So the next few slides, obviously I'm not going to read off all of these profiles, but I did just want to quickly list out in the next 3 slides our different profiles that we have to give you an idea of how many there are. So content is a big part of our history, and we've done a lot of profiling around content. We have 23 current content profiles are listed here. We can go to the next slide. We'll see our integration profiles. And here's our integration profile. Some of these are newer, like bed management is one that we are in the process of publishing for trial implementation this year. Some of these have been around for, as well as dynamic care planning, whereas some of these profiles have been around for quite a while. And if we go to the next slide, we'll see the 7 workflow profiles that we have currently published or are publishing. And you'll notice that some of these have WD at the end of them. That represents it's a workflow definition profile, which is based on the ITI Cross-Enterprise Document Workflow, or XDW profile, but some of these workflow profiles do not, right? So perinatal workflow, remote patient monitoring, these are still workflow profiles, but they're not based on one specific standard. So workflow is not something that has to be tied to a specific standard. It's more of a general concept in the work that we do. We can go to the next slide. So some of these slides are repeats from the previous years we've done these webinars. So I don't want to spend too much time on these. Those webinars, I believe, are available as well, but I do just want to kind of touch on them real quick. These are our existing high uptake profiles. Medical summaries, which you heard Laura mention earlier, was also our first profile, first published back in 2005. There's 2 different options for medical summary. You can create a discharge summary or a referral summary, and it's a content profile, and it's all about the transitions of care between inpatient and ambulatory settings. Exchange of personal health record on the right there is all about the data that would be found in a patient's personal health record. And then the emergency department referral is obviously focused on the care that's provided in an emergency department. All of these are content profiles as well, by the way. If we go to the next slide. So decision support profiles. So we have query for existing data, which is based on HL7v3 messaging, and it's a point-to-point profile, so one system to another, so one ambulatory system to another ambulatory system, for example, would send a query, and it would say, give me your medications, and then that system would respond with a list of medications for that particular patient. And it's intended to tie into a larger decision support type of clinical workflow that the provider might have in place in their system. Care management and request for clinical guidance. These two can be tied together, but they don't necessarily have to be. Care management is focused around chronic disease management. It was one of our first takes at figuring out how to do workflow across several different disparate systems. So it was a very interesting profile. It doesn't have a lot of uptake. We think it was a little bit before its time, but it was important in PCC for us to go through this to get a better understanding of what workflow is and what the types of problems we need to be looking at going forward to solve. So request for clinical guidance would just be the way to access decision support as a service that could be implemented as part of a larger care management scheme. And then retrieve clinical knowledge is focused around patient education, so it's the HL7 HIPPO button standard if you're familiar with that. It's a simple interface to retrieve information on a particular medication or condition or what have you to present in a format to the patient that's in an educational style. We can go to the next slide, please. So existing emergency care profiles, we have the transport record summary profiles. This includes 2 profiles right now. It's the interfacility transport and the EMS transfers of care. these profiles do not have a lot of adoption, but what is interesting is that our last face-to-face, we've got some more interest coming back around with transport summary type of work. So we're expecting some proposals to come in this fall, or a proposal to come in that focuses on non-emergent ambulance transport. So our thoughts are probably what the direction we'll go is to build on the work that we've already done and engage with new stakeholders that we have at the table that are interested. We have stakeholders that have software products that are used in ambulances that are interested in getting engaged and possibly implementing this as well. So it's exciting to see that this is coming back around as well. And then we have emergency department encounter summaries, which is a family of profiles that focuses on documents that are created in an emergency department encounter. And if we go to the next slide, please. So if you've been following PCC, you'll know that we have quite a suite of obstetric profiles that covers all aspects of obstetric care. So it starts with the antepartum period, when the mom first becomes pregnant, and follows that care through that prenatal care up until the point of delivery, which then moves into the intrapartum state, which is represented by the labor and delivery profiles. So what happens in the labor and delivery suite at the birthing facility, what are the different phases of that? There's a family of profiles that represent the different aspects of that. And then following into the postpartum visit summary, so what happens after the baby is delivered and mom goes home, and that piece of it. We worked closely with Sante on this one. We worked closely with the American College of Obstetrics and Gynecology in the U.S. We worked with some forms from the Royal College of Canada as well to come up with the right ways to represent the content from an international perspective. And then following the obstetric pieces, the next natural step is the creation of the newborn record. So we have a content profile that addresses the creation of that newborn record by way of the newborn discharge summary. And this is really fascinating because this is like it's the creation of a new patient's record from day one of being born. So there was a lot of interesting discussion that went into this about when does that actually happen, right? At what point in the delivery and that sort of thing. And then following that, the immunization content is kind of a natural next step. Immunizations are tied into several use cases around children, especially when you start looking at things like schools in various countries. A lot of countries require that immunizations be administered before the child can enter a public school or something of that nature. So immunization content supports this approach. And then perinatal workflow on the top right up there ties all this together, right? So it's one of our workflow profiles that looks at all these different pieces and identifies the different steps in that workflow and how a system would implement that. If we can go to the next slide, please. So existing cross-domain profiles. So, and there's an asterisk up at the top, and if you read the little footnote at the bottom, this doesn't represent all the profiles we have in PCC that reference or have dependencies to profiles in other IHE domains, right? It's more focused on the ones that are clinically based or tied to clinical care paths or clinical workflows. It does not include dependencies on things like a lot of the ITI infrastructure profiles like XDS or PICS or PDQ. Those are more infrastructure technical related. So this is really looking at what's the work we've done with other domains to drill into the specifics of the clinical use cases based on how it crosses the different medical discipline verticals, right, to things like cardiology, radiology, laboratory, quality research, and public health. So these are our profiles that kind of fit into that category. At the top, we have remote patient monitoring. This is all about collecting data from a device that a patient might or a person might have at home, right? So a scale or a blood pressure cuff. It could be a Fitbit or some type of step counter. That data is being collected, right? And how does that data get into the EHR so that the provider can then make use of it when they see the patient at their next primary care visit? So that provides implementation guidance around that particular workflow. And then clinical mapping is, although this is really focused on just mapping between two terminology systems, the use cases that we looked at were around collecting data out of devices and hospitals, so infusion pumps and those sorts of devices. And whereas clinical mapping really could be applied to any type of terminology to terminology mapping. These cases were focused in on how do we get the value sets from the infusion pump, for example, and map those into an EHR system. So we worked closely with PCD to dive deep into that use case, and we came up with the clinical mapping profile as a result. The cardiovascular heart team workflow definition, which is one we're in the process of publishing this year for trial implementation. We'll dive into that a little bit on the next slide. That's, as you might suspect, it's all about the management of a patient's care through the course of a heart team, which consists of many doctors, and what are the different steps that the patient goes through in that care. And then perinatal workflow, oh, not quite yet. We can go back to the previous slide just for a minute. And then perinatal workflow, which is something we mentioned on the previous slide. So this one actually touches a lot of different domains. Radiology, laboratory, patient care devices, quality research, public health, or QUIRF, and it pulls all the pieces together into one large workflow. And then guideline appropriate ordering, which is something we worked jointly with on radiology last year, and it's all about providing guidance around the appropriateness of systems utilizing decision support. And now we can go to the next slide. So we want to take a minute to look at the profiles that we are working on this year, and we're in the process of publishing. We are at, which we'll talk about our life cycle in just a minute in our schedule, but we're at the end of our trial implementation publication period. So we're finalizing those things, and those should be published, I believe, in the next week or two, or maybe 3. So this is one of the profiles that we've been working on this year, and this is cross-enterprise cardiovascular heart team workflow definition. Don't try to say that 5 times really fast. You'll get tongue twisted, I imagine. But this is a workflow-based profile. It's an ITI cross-enterprise workflow or XDW-based profile. We've done several of these over the past several years. And this one's all about the management of the patient's care across a larger heart team. So they go from one specialist to the next, or they have a many-member provider team that manages the care of this patient, and how do they communicate that care? What are the steps in care, as the patient moves through the care paths there? The goal is to improve the efficiency and effectiveness of the information, sharing the right data with the right people at the right time. And we usually show on these slides, we have a nice little pretty kind of actor picture here. A lot of times we'll show the actor and transaction diagrams. The reason you don't see one here is because it's so complex, it really wouldn't do any good. There's so many steps here, and there's so many different variations of care and what could happen. The development of this profile is very interesting because of that. But it was also a testament to the XDW, the underlying XDW profile, because it showed that it can handle it, right? So that's good. So we got to verify the robustness of the technology that we're using for this. We can go to the next slide, please. So bed management is an integration profile that's all about when a patient, the use case is about a patient moving from the emergency department into being admitted into the hospital. It's a process that's been in place for a long time. There's systems that handle this, but those systems don't always handle it very efficiently. If you actually read in the profile, there's some very interesting statistics about the increased risk of death or the poor outcomes of care, or the patient dissatisfaction levels. They're very, very high for this in systems that don't handle this efficiently. So this profile attempts to address those types of problems. It leverages HL7 version 2.5. It's an older and more mature standard. And I thought this was a great example of, it's a new profile that we've developed, but it's not using a bleeding edge technology. So it represents that what we do in PCC and really in IHE in general is we try to match the best suited standard for the interoperability problem that might exist, right? And in this case, we took a look at the systems. We talked to folks who represent these systems out in the fields and we found that HL7 version 2.5 is readily available. So we have to achieve that balance of what's the best standard, what's technologically what's the best standard, but also what's the most available out in the field and what's the most likely to get traction to get implemented. And so that's how we arrived at this decision on this one. But I think it was a good example of that. Obviously, the systems in play here are the Emergency Department Information System and the hospital EHR. We can go to the next slide. Our third profile we published this year is called dynamic care planning. And this really is in line with this whole workflow concept or theme. Dynamic care planning is not a workflow profile in itself. It's more of an integration profile, but it represents a lot of the challenges with defining clinical care workflows. If you want to compare it to like a radiology workflow where things are very structured and ordered. So a patient goes from one room to the next, and they have an x-ray here and they have an x-ray there, and they show up here at this time, and they're checked in and they're checked out, and it's very controlled. It's a very controlled environment. And then the course of care for that particular episode or visit or whatever is done. And that's a little bit more straightforward to profile in many senses, whereas with primary care, it's a lot more challenging because you're dealing with things like medication adherence, right? How do you ensure that the patient took their medication? You can't, or you can ask them. They may answer truthfully, they may not. Maybe they just forgot. Maybe they were dropping their kids off at school and forgot they had to take their pill, right? Or they might miss their appointment. So how do you deal with all these exceptions? And there's a lot of them, right? And especially when you start looking at complex cases where you have a patient that sees multiple specialists. So they have, foot issues, so they go to a podiatrist. They have, vision issues, so they go to their eye doctor. They see their primary care doctor for their diabetes management, and then they have an emergency event on the weekend. They go to the emergency department for something, and they have a whole team of doctors there that's dealing with something. And it's hard to track these things across all these different systems. So dynamic care planning is a profile that helps to promote collaboration between patients and providers, and also payers. There's a payers portion in here too. So it's all about creating that partnership and helping the communication of care plans between those parties. The standards that it's based on include the HL7 Fire Care Plan and Subscription Resources, as well as the HL7 Care Plan Domain Analysis Model, the HL7 Care Plan DAM. So this is an exciting profile. You'll see the actors and the transactions on the right. There's a care plan contributor and a care plan service. And there's your basic update, search, retrieve, and subscribe to care plans. If we can go to the next slide, please. So now we'll jump into PCC participation. How do you get involved? IHE has an organizational membership model. There's a URL here with more information. There's 180 plus members currently. There is a modest annual fee, but I will attest that it's very modest. As a member, Ready Computing is a member, Intermountain is a member. It shouldn't be a barrier to participation. But what you get with being a member is you get the opportunity to participate in any domain, in the planning committees, in the technical committees. You get to understand what's coming down the road. You get to understand the why of IHE profiles, why they were created, why certain decisions were made. So there's a lot of value in being involved. There's 13 domains, clinical and operational domains, are all listed on the IHE website. They were shown earlier in one of the slides as well. And each domain has a planning committee and a technical committee. And then we'll get into the details of the planning and the technical committee in a few slides later. And then this last bullet here, non-members may participate in comment periods and implement technical frameworks. So you certainly don't have to be a member to get engaged in IHE in some way. Next slide, please. So PCC planning responsibilities. So as you might suspect, the responsibilities include strategic development and road mapping, where are we going, creating our strategic goals, reviewing our vision and mission every year or so to make sure we're still heading in the right direction. We identify priorities of the domain and also attempt to identify any particular problems and challenges we might have and propose solutions to those. We're, of course, responsible for recruiting new members and educating implementers. And then aligning industry initiatives is something that's really important. There's so much going on in healthcare IT right now. I've often heard it's the last frontier of electronification, right? And so it's important that we look outward, too, and look who can we align with, right, to harmonize what we're doing here with other standards development organizations or other, appropriate societies, medical societies or others that have a stake in healthcare and improving patient outcomes. So are there things that we're doing that they should know about, or vice versa, right? Should we be asking questions and finding out what other initiatives are doing to ensure that we're aligned as well? And then finally, we review and recommend IHE profile proposals, which we'll get a little bit more into when we talk about the life cycle of development. And if we can go to the next slide, we'll take a look at the PCC technical responsibilities. Oh, I forgot to mention on the previous slide. So obviously, you're talking to the two co-chairs today. I'm the outgoing co-chair, so this is my final term. I will remain engaged in PCC, though. But I've been planning co-chair for the past 4 years, and then Laura will remain as co-chair. And we have another new co-chair we're expecting to come up and join us, so we're excited about that as well. And then there's links here to the wiki page and to the Google groups. So the technical responsibilities include the development of IHE profiles. So the technical committee, I like to say, does the real work, right? They do the hands to keyboard work. They actually write the profiles, do the maintenance of the technical framework, process change proposals, that sort of thing. And then the current projects are listed here, which we just reviewed. Our two co-chairs for that are Emma Jones. Emma works with Allscripts and has been with PCC for a long time, and then Denise Downing works with AORN, and she's been with PCC for a long time as well. So we're certainly fortunate to have their leadership in the technical committee side. We can go to the next slide, please. So the IHE profile development cycle. So there's another slide following this that we'll take a look at that has a picture, which we'll talk through all these steps. But I wanted to kind of list them out in bullet form here, so you can kind of get both kind of perspectives. So we operate on an 18-month cycle. We accept profile proposals. We then move forward with profile development based on the proposals that were received and decided to move forward with. We move into a public comment period, then we move into a trial implementation and profile testing period, which is the ConnectedCon, and then we process any feedback and from that testing and adjust as appropriate. All the domains, IHE domains, have independent schedules. We align our schedules with the ITI domain, IT infrastructure domain, and the quality research and public health, or QURF domain. So we typically always meet at the same time in the same face-to-face locations, but the other 10 domains, they have different schedules. But we coordinate with those other domains as appropriate on teleconferences or however we need to meet the tasks that we need to meet. As I mentioned previously, there's opportunity for non-members to participate, obviously opportunity for members to participate in the profile development and public comment. Non-members can participate in testing and implementation. They can also submit change proposals, right? We want IHE to be an open process, so it's important to allow folks to, if you find an error, if you're an implementer, say you're not an IHE organizational membership or member, but you have tested a profile and you find an issue with the profile that was written, then we encourage you to submit a change proposal and tell us what's wrong and propose a solution on how to fix that, and then the technical committee would take that and review it and apply the appropriate fix. And if we can go to the next slide, we'll see a nice, pretty picture of the process. So I know there's a lot going on with this slide, but I'll kind of talk through it starting at the bottom left. So in months 1 to 5, there's a call for proposal that opens up, which is where we are right now. So our current proposals, they run until I believe it's September 27th. There's some dates later on in this slide deck. So you have until the end of September to submit a profile proposal to the PCC domain as well as ITI and QRPH. And then we go through a selection process where we have a series of meetings, both planning and technical, to determine what we will work on for the next cycle. And then moving up the picture here on the top left, months 6 through 13, we write the profiles. We write volume 1, then we write volume 2 or 3 or 4 if appropriate. We publish those out for public comment, usually for a month-long or maybe a 6-week-long period. We certainly like to get public comments back, so that's another way to engage and participate is review the work that we publish for public comment and provide your feedback. The more feedback we get, the better. It just means that people are reading it and that it's relevant, and we want to produce things that are relevant to the industry and that will have good, solid impact and positive improvement. And then we publish the trial implementation version. And the trial implementation state means it is ready for testing at an IHE Connectathon, which you see in the top right here. And then after testing at the Connectathon, vendors can choose to publish their conformance statements in the IHE product registry. And then following the Connectathon testing, there's opportunities to demonstrate at events like the HIMSS Interoperability Showcase. And then finally, the ultimate end goal is to have this installable at end-user products and clinical settings around the world to improve safety, quality, and efficiency. You can go to the next slide. And this is just a simple table of our schedule. So the red highlighted trial implementation published row is where we are right now. And then following that, and this table reads a little funny because we're always in an ongoing cycle, and that cycle overlaps, right? But this shows the dates is the most relevant dates is to right now, is to this week. So trial implementation is being published right now in August of 2016. Then moving down, IHE Connectathon registration, it opens in September, it closes in October, and then the Connectathon testing is in January of next year. And then you'll see the other dates for the call for proposals, proposal review and selection, proposals drafted, and so on. And then there's a link down here at the bottom to the meeting schedules for the different for the ITI, PCC, and CORF committees, because we always meet jointly, as mentioned previously. Next slide, please. So IHE Connectathon, if you're not familiar with it, they are held around the world. They're great big testing events. You know, some are big, some are small. I believe the North America Connectathon is the largest one with, I forget how many companies participated last year. I think it was 200 plus. So you've got 500 to 600 engineers in a room all testing interoperability. If you're a programmer at heart like I am, that kind of stuff really excites you. But even if you're not, there's a lot of great conversations going on at Connectathons. There's a one-day conference that's held every year, so you can go check it out. But really, it's an unparalleled testing opportunity, right? It's the best QA lab in the world for your software, for your interoperability-enabled software. Connectathons are open for all to participate in, and they're held, for the North America, they're held in Cleveland, Ohio. And then there's a link down here at the bottom where you can register for the North America Connectedcon, which is hosted by IHE USA. You can go to the next slide, please. And then so finally, I believe this is our last slide. It's just a slide of links and resources, a lot of what we talked about. If you have any questions you know, about PCC in general, email IHE@pcc.net. If you want to sign up for the IHE International News, you can email secretary@IHE.net, and some other links that are relevant here. Also wanted to, I forgot to mention earlier, I wanted to put an announcement out there that we're also working on, in regards to workflow, we're doing kind of a deep dive assessment on what does workflow mean within IHE. This is a joint effort between a few different domains. We're trying to understand and better define workflow. There's all different levels of workflow. There's profiles that support workflow that are more like workflow mechanisms, and then there's profiles that really focus on the clinical aspect of workflow, which is a lot of what we've done in PCC with things like the cardiology heart team workflow and the perinatal workflow. And so we're doing an exercise where we're doing some research on this to better understand it and define it, and we are going to have a workshop that's going to be a 1 or 2 day workshop in the fall of this year. We don't have a specific date yet. And one part will be focused on profile authors, writing workflow profiles, but the other part will be focused on implementers. So if you're an implementer looking to implement IHE workflow-based profiles, this would be a good opportunity to get a better idea of what does workflow mean within IHE and what's IHE's approach to workflow and what does it mean also in the industry and that sort of thing. So if you want additional information about that, you can certainly email me. My email address is in this slide deck as well, or you can email secretary@IHE.net, and there should be some things coming out and various announcements too at some point. So we're still coordinating all that though and finalizing the date. So with that, I believe that concludes our presentation for today. I think now we'll open it up for any questions and go from there. Nancy, do we have any questions come into the chat box.
I have not received any questions to date. As a reminder, I have unmuted the lines for the participants if you'd like to pose any questions live.
Questions or comments or observations or anything. This is really kind of open discussion time, so we certainly welcome your feedback, your thoughts. Thank you, Nancy. Nancy just posted a workflow email address. There's IHE Workflow at googlegroups.com. We'll also include that in the slide deck as well. That'll be shared out. So if you want more information about the workflow workshop, send an email to that email address. So I'm not hearing any questions. If you are asking a question, you might be talking to your mute button. So with that, I think we can conclude, unless, Laura, you had any final comments, or Nancy, you had any final logistical things to wrap up?
This is Laura. I do not, but I just want to thank everybody for joining us. And if questions come up later, obviously reach out to us. We're happy to help.
And again, I just wanted to thank everyone for joining us this morning. I did want to remind everyone that we briefly mentioned the call for proposals, which opens up August 11th, which will be this Thursday. And if you have any additional questions regarding any of the materials that was presented today, I have posted my email address in the chat box. Feel free to send me an email directly, and I will be more than happy to direct your email or provide you with any information. Thank you all for joining us, and this will actually conclude today's webinar.